Welcome, everybody. It is nice to see your virtual faces, and I look forward to seeing you all again soon in person. Today, we're going to be going through a lot of information, and I'm going to try to make it as interesting as possible and try to get you out of here early so you can get back to your classrooms. But the information presented today comes from Ready Schools Safe Learners. You'll hear RSSL for those acronym lovers. And this is everything that we have to do and that we have to train you all on to welcome kids safely back into our schools. So there's a link here in the slide deck to the full RSSL guidance. It's about 88 pages long, maybe more now. There's been some updates. But this, in conjunction with information from the Oregon Health Authority and the CDC, outline all of the guidelines for health and safety, as well as for instructional protocols for returning to schools this year. So there's this piece, and so we're going to go through just some of the information in the first 3 sections today, and mainly the pieces that are going to affect what you do daily in the buildings. And then also districts have had to submit an operational blueprint, which takes what is in this document and talks about how Parkrose is going to put in place all of these things that we have to do. Our operational blueprint does exist. We're updating it right now, and it is on our website if you so wish to find it. But a couple of things for this is that they have to designate some people that are kind of the primary points of contact, and these at buildings are principals and secretaries. And also has to have a site process that allows for sharings of concerns about safety protocols. So do check with your building principals about who that designated person is. And it allows for both named and anonymous sharing. And then as we made this blueprint, it had to take into account everyone that is in our schools. So high-risk populations with medical and behavioral needs, and also specifically calls out the need for interactions with peers. There's a lot that is in this document, so we're going to stretch it over 2 days. So today, we will really talk about school day guidelines and some of the things that will be new and that we will have to think about as we welcome kids back. And then tomorrow, we're really going to dig into a lot of the health and safety responses. So we'll touch on kind of overviews today, and then for some of those things, we'll go deeper tomorrow. And tomorrow's day will include Julie Sams and our MESD nurses going through some of the responses for outbreak protocols as well. So if we don't get questions answered today, we'll collect some and have some time tomorrow too for that. So just a couple of kind of housekeeping and things to know. There's a lot of info in these slides, but you have access to this slide deck. And then after our training today, I'm also going to send out kind of a 1-pager, I think it's 2 pages actually, document that has links to the decks for today and tomorrow, also links to helpful resources as you think about setting up your classroom, resources to share with families to help them kind of navigate the new. So you'll get all of this information that you can look through again. We are required by the RSSL to walk through all of this. So like I said, I'm going to try to make it exciting, but I can't promise that. We'll cover some today, some tomorrow. There may be repeats of crucial information as well. And then just as a warning, changes are happening really frequently. So I made this slide deck about 2 weeks ago, and in that course of time, there have been 3 different versions of the RSSL. So if you have come to a previous listening session, some of the information may be different today than what you heard previously because it has been updated. As we think about changes and how they impact Parkrose, just wanted everyone to know right now we're sticking to our current plan for reopening. And as changes do happen, as updates are made, we'll come together as a district and look at how things are working, determine what's possible, and then make those necessary changes. But if there are changes that happen, like there were some this last week we'll talk about, that impact your day-to-day activities, we will make sure that we keep you updated on those. As we work through today, we're kind of going to work in sections. So if you have questions, do put them in the chat, and Christine is kind of monitoring them and hopefully will answer them in the chat. But then if we don't get those answered that way, we'll have some time today to to stop and ask questions. If you don't like using the chat during those times, feel free to unmute yourself and ask as well. And then also on the slide decks, if you want to know more, you really are excited to dig into this RSSL. On each of the slides, you'll see a little box that tells you where that information is located. So today is really just a broad overview. So if you want the full details, you can easily find that. All right, so before we really jump into all of those critical guidelines, I wanted to start with this. And this actually comes from some of the supplemental guidance. And there's a link up in the corner there that you can find the full document. But while we're not going to jump really into a lot of the instructional pieces today, this is really more of a compliance training. I did want to kind of just bring this forward so that we all have this in our mind. There's a lot of talk around learning loss that's happened over the last year. It's been a strange year for our students, a year unlike any other they've had, and hopefully will never have again in their lifetime. But it hasn't been a lost year, right? We have unfinished learning, definitely, that we need to tackle, but our students this year have learned so much through their lived experiences, through having additional time at home with their family. They've built new skills and resources that may not have been possible to build in our typical school settings. And there's actually some research that's been done to back this up. And in the little box in the bottom, I share this quote because I love it, that in fact, by centering the learning experiences students have daily in their family and community contexts, educators will actually be more likely to accelerate that unfinished learning when they do come back in our buildings. So just have this in your mind as you move through this week and be thinking about the fact that, it wasn't a lost year. It was a different year. It's been a different year, but it's so exciting what our students are coming with that they may not have gained previously. So with that in mind, I just wanted to take a minute in the chat, think about what is it that our students already know? What new skills are they bringing with them that they didn't have? What new funds of knowledge have they grown since last spring? And we're just going to take a minute in the chat to type something that comes to mind for you. Flexibility, definitely. Us too, right, as adults. Health and safety, yeah, our kids are pros at that now. Empathy, resilience, tech skills, appreciation, adaptability, patience, compassion, even things like washing hands, right? Typing, right? Yeah, definitely. My kid can type now. That's exciting. Navigating technology, sometimes a joy. Yeah, that plays in a larger community, right? I think that's a huge takeaway, right? We do things not only for ourselves, but for others. Family connections, definitely. Perseverance. I mean, just reading through this list, this is just such an amazing list. And I know it's so easy to fall into, I mean, I do it, right? What is my kid missing, right? But there's so much that kids have gained. And I think just looking at this list as folks continue to type, these are great opportunities to build on, right? So what does advocacy now look like as we bring them back to the classroom? What does empathy look like? What does creativity look like as we bring them back to the classroom? So just keep these with you. As we think about all of these new guidelines we're going to walk through today, and we think about how we're going to navigate them, we think about how we're going to help kids navigate them, keeping in mind that kids are bringing some great things with them. And it's just a great opportunity for us to use those wonderful strengths that they've gained this year to then tackle that unfinished learning. Feel free to continue typing those. I love that list. So our goals today are to understand the new RSSL guidelines and really what they mean for how we operate in classrooms and buildings. And then just to really briefly begin to think about how we can support students in these new ways of being when they return. We'll have a little opportunity for a breakout session and then to do some brainstorming between buildings, and then also some opportunities in the chat too. All right. Again, if you have questions, type them in the chat and we'll have opportunities to stop if you prefer to ask them out loud as well. We're going to start with key practices for prevention, which most of us are super familiar with these already, but we do have to walk through them. Hopefully we know by now what the transmission of COVID-19 is. 3 really main modes: direct contact, droplets, airborne. So the protocols that we've all come to know really are to prevent that transmission in those 3 ways. So distancing protocols, if you came to previous sessions, have changed in this last week. So for elementary students, what that means is we have to still support that physical distancing and all the daily activities inside and outside, but we're looking at 3 feet as opposed to 6. So for students, we want to try to maintain at least 3 feet between students to the maximum extent possible. So if they're closer than 3 feet, all of a sudden, we're not going to panic, because it's really about space and time. And so we want to just limit the time that kids are closer than 3 feet and have it be less than 15 minutes, right? Because we're also wearing masks, and that's the other big safety protocol. It's a little bit different for staff. So staff still have to try to maintain 6 feet at all times to that maximum extent possible. So in the classroom, what this means is that rooms should be set up to allow for the ability for educators and students to move about the room while still maintaining distance. You want to consider the temporary and limited use of visual aids, so things like signs, arrows to illustrate traffic flow. And our custodians have just asked that if you're using tape, that you use painter's tape or floor designated decals only, just to help with the cleaning piece of it. But definitely think about what are those things that you can put in your environment that are going to help kids navigate that, right? And they may not need it for the rest of the year, but just as you initially get things set up. You want space between desks. They should be placed, 3 feet distancing. Your desk should be, if you have one, should be farther apart. And then assigning seating so students are in the same place at all times. And when possible, you can face desks in the same directions, or if you have desks, they're sitting on one side of the table. But we know that with our furniture and our classrooms, that's not always possible. So Robin, our maintenance supervisor, has put together just some simple illustrations here of what it might look like. So you'll notice in our classrooms and our tables, we do have kids sitting opposite, and that's fine. You can even tape, lay out tape on tables to help kids know what their space is. In some schools, custodians have already placed your tables. So just if that's the case, please check with your principal or your custodian before you make changes. All right, so distancing, number 1, we've gotten familiar with that, right? I've never been more aware of my own physical space when I go to the grocery store. So face coverings and masks, also something that we are getting used to. They have to be worn by all staff and students in grades preschool and up, both indoors and outdoors. They can be disposable or they can be cloth. There are cases, and we'll talk about that in just a minute, where you might have students that have a medical condition or a disability that prevent them from wearing a mask or a face covering. And in those cases, face shields are used. And again, we'll talk about that in a moment. And we do have disposable face masks that are available for staff and students. You should have them at buildings already. So if you need them, please just let your principal or secretary know. If you are a teacher that your role requires you to be in closer contact more regularly with students, you do have access as well to full PPE, so gowns or gloves or goggles, and these will also be provided for you. One thing to note about PPE is that if it's single use, it has to be disposed after that use, so you can't reuse those. Reusable PPE just has to be washed after every single use. So there are instances where you might have students that are not wearing a mask. So if a student is not wearing a mask or a face covering, and it's due to a values-based decision, so meaning the family is just saying, we don't want to wear a mask, the student cannot participate in on-site learning and they have to be provided CDL. However, for students that aren't currently served under an IEP or a 504, if this is something that's happening consistently, where a kid is really struggling to have that face covering, you'd want to meet with your school team just to make sure that that inability is not due to a disability and that we're missing something. You will have students in the building that are not wearing masks due to a medical condition or disability, and there are provisions under the RSSL with IDEA and ADA. So if it is part of their IEP or 504 or medical directive, students are allowed to be maskless. And if we have these cases, it will be conveyed to teachers. Students cannot be excluded for not wearing a mask in this case. If they can tolerate a face shield, that can be substituted. And teachers will be notified by case managers of specific accommodations for students. The other things that happens is that families are also notified, not of a specific student and name, confidentiality is still kept, but just of the fact that there are students in a cohort not wearing a mask, and what the plan is to still keep everyone safe. What if a student needs to remove their mask? All of us mask wearers know that there's just some times where you can't have it on anymore. And there are provisions in the RSSL for this as well. So it talks about a specific or urgent need. So for example, students, if they have a water bottle, they can take their mask down and take a drink and put their mask back up. That has a small amount of risk. We don't want kids to be thirsty during the day if they need water. But if there is a kid that has an urgent need and is displaying that, we can provide for a short break, 3 to 5 minutes. And what this looks like is providing space away from peers, either a designated spot in your classroom or preferably outside, where they can take a supervised break, support that re-engagement in safely wearing the mask or face covering. It's intended just for a single student for very limited time, not formally tied to an accommodation. Can't discriminate against students if they're needing this, but we also can't have whole class mask breaks. So this is really just intended for specific urgent moments for individual students. And we do know that there are going to be students that struggle with this. And so just wanted to call out, make sure that as you're talking with your building sites this week and making those building site plans, that you are understanding how your proactive and preventative steps have changed now during COVID, how that response to dysregulation has changed, but just always keeping a really student-centered approach, teaching those routines, but knowing what the plans are for kids who do need behavior support in navigating all of this. All right, hand washing and sanitizing, which we already do a lot of, right, in these times. So we all know this, wash hands for 20 seconds with soap and water, or you are welcome to have kids use hand sanitizer. Your buildings have all been provided with hand sanitizer that has 60 to 95% alcohol content, and that's fine to use as well. RSSL just suggests providing time as you think about your day for cleaning hands in the classroom. Kids do have to clean their hands when entering the classroom, before and after recess. We aren't eating at school, but should that change, before and after eating, and then also before and after using a shared learning material. So those are just some times to think about as you plan your routines for the day. The kind of final big preventative measure is this cohorting. So you guys, I know, have spent so long making your cohorts and contacting families, and that's an important part of keeping kids safe. So students may be part of more than one stable cohort. That is a change. So if you came to any of previous sessions, then you may have heard something different, but this just altered. So that doesn't mean that we want kids part of tons and tons of cohorts. We still want to minimize the number of staff that interact with each cohort and the number of cohorts that each staff interacts with as well, just to the extent possible. But there is no limit now to the number of contacts during a day or the number of cohorts that a student can be part of. But we do, like I said, just want to minimize those interactions. Staff who do need to work with multiple cohorts have to wash and sanitize their hands between interactions. You do want to try to keep cohorts distance from each other, but we will have contact tracing as well to facilitate tracking if an outbreak does occur. And that's really what the cohorts do. What constitutes a cohort? We've got lots of them, right? So your main classroom, your bus, title group, SPED, recess, speech, ELD. If you have 2 kids meeting together in any way, that's considered a cohort. And so all of that really has to be tracked. And we will, we're going to touch a little bit on that today, but really we'll touch about the tracking piece tomorrow and kind of dig in a little more deeply to that. And then I just wanted to reiterate, because it's in our RSSL often, is that students can never be excluded or disciplined for struggling to learn to adhere to new procedures for how school operates. This is going to take time. However, I was talking to some teachers in a different district, a friend of mine, and they said that the kindergarten teachers in their building, you know, the kids already knew, right? It was easier than they thought it was going to be, because kids know how to mask. They've heard the distancing. And so while they taught the procedures, the kids really already knew them. So we're going to pause for a minute and just spend a little bit of time in some small groups. Before we do, Christine, are there any questions that we need to bring forward to the group?
I don't think so. I think I'm getting them all in the chat.
Awesome. All right, so I just wanted to provide a little bit of time for you all to get together in some groups, maybe with folks from another school, and share some of the ideas that you have about supporting students in understanding all of our new routines, especially in these first couple of weeks. So for example, what types of cues are you going to give them in the classroom for that distancing? There's a link here actually to a lesson that I thought was great around feelings and how you can still figure out how someone is feeling through their eyes, right? If someone's wearing a mask, and that's hard for kids, it's hard for adults. So some ways we can support that. Supply management, greetings, ways that you can help kids in still connecting with each other, because even though we have to be apart, it doesn't mean that we're isolated from each other. We're still connecting, and that's a big piece of this return to school. So Jason's going to put us in just some random small breakout rooms for a few minutes to just share some of these ideas. And then we'll come back and have a little bit of time to touch base on questions before we jump into our next section. All right, welcome back, everybody. So in the chat, if you could just take a moment and type what's one thing that you heard in your group that maybe you think you'd like to try, or something to think about, or one question that came up as you all were talking. So just take a moment to put that in the chat. See lots of folks talking about visuals for that 3 feet, right? I saw a cute picture in some news article the other day where someone was teaching their kid 3 feet using stuffies, right? So keeping the stuffies 3 feet apart. Yeah, centering care. Explaining that why is so important, yeah. Important to find ways to keep CDL students feeling connected, definitely. Could be some interesting opportunities for letter writing there, or sharing work back and forth, right? Visuals. I was telling the last group that I saw a news article about a grocery store that instead of putting feet on the ground for distancing, they commissioned a local artist to create pieces of art, and then had those created into decals for the floor. And I think yesterday, in maybe the early learning group, Erin shared about a teacher that really got the kids involved in understanding that why and what they could and couldn't do, and had them create kind of this chart that was like, what are the things we can do and what are the things we can't, right? We can't give each other a hug right now, but we can give each other an air high five if we want to celebrate and connect, right? So having kids be involved in that. Thank you so much for doing that and sharing your ideas. And just, I know one of the things that came up in some of the questions at the end last time is just finding times to share what's working and what isn't. And I think that's really important, especially in this time when everyone is very isolated in their classrooms. So please do, if you're finding things that work, share them with others, or if you're not sure how to share them with me, and I will share them with others so that we can all learn from each other as we move through this. We're not going to spend much time here, but I just wanted to call out, there are resources that are already available. CDC has some good resources for supporting families with all of these prevention measures. They're in different languages, some quick guides that can kind of help you figure out some of these regulations or help families figure those out as well. So the link is there. So any questions or anything in the chat that we want to bring forward, or you're welcome to unmute yourself if you prefer just to ask. So anything about that section so far? Prepping kids and families to let them know we won't be able to give them hugs and high fives, even though we want to, right? I know, and that's going to take some time and some teaching. One thing that I'm happy to do is, I know that and I'd have to do a little searching, but there are some great social stories that have started to be created by different folks. And later today, I'm going to send just kind of a 2-page document that has the links to these slideshows and other things. And so I can do a little digging and see what I can find and link those on there for you all too. Oh, so many great ideas. I love it. All right. We're going to move on now to kind of sort of the day-to-day, right? We have all of these things that are the new safety protocols, but then we have different things throughout our day that will change a little bit too. Some of them will look the same. So I want to spend just a little bit of time talking about what the RSSL brings forward in these areas. Feel free to keep typing your questions or ideas in the chat. So for arrival, the main things just to know is you maintain those stable cohorts and the distance and cleaning requirements, right? So high touch surfaces are going to be cleaned. You're going to assign students or cohorts to specific entrances so that assigned staff can conduct a visual screening. We'll talk a little bit more about that. That visual screening can be at the door they come in. It can be at the door to the classroom. But just to make sure traffic patterns flow and there's no congestion, spreading students out where they enter throughout the building. And then ensuring attendance and sign in and sign out protocols to facilitate contact tracing. And we'll talk about that a little bit later too. So one of the things that site leadership will be going over is what your arrival will look like, what building door they'll come in, who's going to be in charge of that visual screening, and that type of thing. For attendance, so just like we've normally been doing, you're going to take attendance during the morning when all of our class is there, as you do now on Synergy. In the afternoon, you're going to be using a district tracking sheet to take attendance in the afternoon, and we'll go into that more tomorrow, but it's made for you and we'll show you how to use it. And really the main goal of this is to aid in that contact tracing in case there is an outbreak. And so staff will be required to track themselves, kind of which cohorts they interact with, and then also if students are moving between cohorts as well. So the entry and screening has changed a little bit. So if you came to a previous session, this might be different information. One thing that hasn't changed is if you're sick, please stay home. So both staff and students, if you have any COVID-19 symptoms or any kind of illness, please do stay home. Staff, you will have to self-screen, so you can report if you have symptoms or if you've had close contact when you enter the building, and then you'll have to sign in as you do now for contact tracing purposes, so we know who's been in a building in case there is an outbreak. When students arrive at school, it's a visual screen. We're not going to go into that today in depth, but tomorrow when we meet with Julie and the nurses, we'll go in to some tips for what that visual screen looks like, because there's some specific things to look for that can help you understand whether one of those symptoms exists. You're going to sign students in on that tracking sheet. Students are going to sanitize their hands prior to entering the building or the classroom, however your building decides to do that. And then just noting that students that are riding the bus are going to be screened prior to the bus, and then again when they get to school. Here's those symptoms. We will go into this more tomorrow, but just wanted to point them out today. New one may have been added since you've seen this last, is the vomiting, and the diarrhea was added as well. So those are those things we're going to be visually screening for. And again, Julie and the nurses will give us tips and clues tomorrow on how to make it effective. One question that has come up is, are we doing temperature checks? And that has been removed from the RSSL because it was determined that it wasn't really an effective screening process. Didn't have an impact. I also do want to point out the confidentiality pieces because there's been some questions around this. So with health protocols, we're dealing both with FERPA and with HIPAA. And so FERPA does allow schools to share personally identified information with our local public health authorities without consent if we need to for a health emergency. So our local health authority is our Multnomah County Health Department, and our MESD nurses are our partners in all of this. We do want to emphasize not to share student and staff health information, including a COVID-19 diagnosis. So if there is a COVID-19 diagnosis in our district, you will not know who it is. If you have been in close contact with the contact tracing, you'll be notified, and MESD nurses will provide the information that's needed to ensure that everyone is safe. But we really want to safeguard, for many reasons, our students and staff health information. You may have times where students or staff do have symptoms at school. I'm just going to give you a brief overview today, and we'll dig in deeper tomorrow. So you have some context today, so that then when we dig in tomorrow, you'll already have some schema in your head around it. So if you, as a staff member, develop symptoms while you're at school, you need to notify the office, and then there has to be an isolation room. We didn't like the name isolation room, so we're calling it a care room, but you may call it something different at your building. But you're going to report then to the care room because there's some symptom tracking that then needs to happen. And then you'll go home, and MESD nurses will contact you around next steps. If a student displays COVID symptoms at school, you're going to contact the office to let them know. And then you're going to supervise the student while sending them to the office. So that doesn't mean you have to walk them down, but you do have to, you stand at your classroom door, somebody's at the other end of the hallway, and you're monitoring them just visually. And that's just to ensure that they're going straight to the office and not going someplace else to mix cohorts. The office staff will contact the parent or guardian, and then the student is in that designated isolation area, that care room, being supervised and monitoring those symptoms until the parent or guardian picks them up. And then kind of the behind the scenes work happens. And we will talk about that tomorrow so that it's not a mystery to anybody, but essentially there's some symptom tracking that happens. The nurse also will contact families, and then the MESD nurses are the ones that then advise around the school what the next steps are, whether there needs to be contact tracing, how long the child needs to stay home or the staff member needs to stay home. So we'll dig more into this tomorrow, but that's just kind of a general overview. Visitors and volunteers. So we're trying to restrict and limit folks that are in our buildings. So restricting non-essential visitors and volunteers. So essential community partners, law enforcement, DHS, MECP partners that come in and work with our preschools. Those are all great, all fine. So non-essential, classroom volunteers, parent clubs, those types of things. It doesn't mean that families can't come into the building if they need to come into the office. We're just not going to have folks working in classrooms to limit the contacts. But if a parent or guardian does need to come into the building or outdoor learning space for any reason, they have to follow the same protocols that we all are following. So they have to be screened, they've got to sign in, they have to wash or sanitize their hands when they come in, maintain that distancing. And if they have symptoms or do report that they had close contact, then they cannot come on campus at that point. And so we have to figure out a different way of communicating. Then on the other end of the day, we have dismissal. So just the same as arrival, maintaining stable cohorts and distance and cleaning, having those students or cohorts go to those specific entrances. You do not have to sign students out at the end of the day unless they're leaving early. So if they're leaving early, just like we would now, sign them out, and that just is going to help them facilitate contact tracing efforts. All right, so any questions that came up during that time, Christine, to bring forward?
Nope, I think you're good.
All right. Anyone that wants to mute and or unmute and ask a question?
What if kids have severe allergies?
Yeah, that's a really good question, Sue. So we'll talk more about this tomorrow, but essentially there's some guidelines around exclusion that have been developed with COVID in mind. And so if someone has allergies and that's documented, we're not going to be excluding them for that. So keep that question in your head, because Julie and the nurses will share some specific kind of scenarios that will help us determine. And really, it's not going to be up to classroom staff and teachers to and staff at buildings to determine exclusion. That's where those MESD nurses are going to step in. We're really going to be the ones that are gathering the information so that then the health authorities can make the decisions about whether a student needs to stay home or not. And we have great MESD nurses. Any other questions?
Can I see that last screen?
Yeah, of course. For sure, Michelle. Hang on. This one?
Yes, thank you.
Yeah, of course.
Done.
All right. A little bit of feedback. So if you're not muted, please mute yourself. That'd be great. Thank you. Okay. So we're going to talk a little bit about the cleaning pieces, managing materials and cleaning protocols, because I know there's a lot of questions around these pieces too. So this is what the guidance says. And it's not much different than what we typically do, right? We're going to clean and disinfect touch surfaces and shared objects. The difference is we're going to be doing it multiple times a day and with more frequency. What it means for Parkrose, our custodians will be cleaning high touch surfaces and all the common spaces throughout the day. And then we have additional night custodial staff that'll work deeper on disinfection too. And I do just want to give a shout out to our custodial staff and maintenance department who've been working so hard to navigate all of the cleaning, the RSSL guidelines, the CDC guidelines, to make sure that our classrooms are ready for students and comply with all of the new guidelines that exist. So if you see your custodian, give them a big thank you. What it means for teachers and staff in classrooms. As you think about your routines, providing extra time for some of those transitions for cleaning and disinfecting high touch surfaces, materials between student uses. You're going to use district provided spray and leave disinfectant. This is actually really effective. We can still wipe down tables like we normally would, right, at the end of the day, but then you're going to spray them, you let it sit to dry, and once it's dry, the items are disinfected. And like I said, like usual, you're still going to wipe down things at the end of the day as you normally would. Students can be involved in cleaning tables and materials, and staff and effective cleaning supplies are provided for you. So they should already be there. If you don't have it or you have questions, please talk to your custodian. With materials too, whenever possible, you're going to assign individual materials to kids and avoid sharing community supplies. However, there are some shared supplies that do need to be used, and that's okay. It would just mean disinfecting those between uses with that spray. And there's some items that can't be easily cleaned, like books. And we can use books in our classroom. And the OHA had some recommendations to the library. They're in the RSSL that basically if you have an item, a book that's been used, you're going to take it out of circulation for at least 24 hours before you return it. And I know I had a teacher in early learning group yesterday that shared that she had made a book bath, right? So just a bin that then kids could, after they'd used a book, put it in there. We had some recommendations also in the last training session around how you might, rather than having kids browse through books, how you might display some books, do some book talks, have kids choose some of them, have a book box at their desk that then they have their books for the week or for a couple of weeks, and then they can be easily rotated and circulated. One of the big things to do really with materials is just have kids wash or sanitize hands before and after use. And that mitigates a lot of the risk with those shared equipment and materials. Although it's not required, it is recommended that you assign cubby or storage boxes for individual student supplies or belongings. And if you need materials purchased, we do have some funds set aside with our ESSER grants, which is the federal grants that came as pandemic relief. So please let your building principal or secretary know. I also wanted to just point out a quick consideration because most of us have probably experienced this already, but classrooms will be disinfected after school hours daily using an electrostatic sprayer that does, there is over mist with it, right? And so student work or things that are out may get damp. Couple of good suggestions that have come out. Obviously, we can laminate signs that need to be up all year to protect them. If you want to display student work, which we all do, right? We want the students to see their fantastic work for on the walls, using individual sheet protectors, right? And putting kids' work inside of those. And then just a request from custodians that papers and things that are sitting on desks be put back into cubby boxes or stored in a desk each evening so that then those don't get wet as things are sprayed. All right, any questions that came out, Christine, from any of that we need to bring forward?
A handful of things that are just around cleaning, but I would say that those are things you want to talk about with your building custodian. You're going to have really specific your room related questions, and your building custodian is the absolute best person to answer those.
Yes, agreed. If you, as you're thinking about cleaning, like for boxes and things, cloth can't really be cleaned, right? I did check yesterday with Michael, and I know like Prescott folks, you guys have a lot of like bulletin boards that are covered with fabric. So check with Vincent and see, as far as from the RSL standpoint, that, that seems to be like it will be okay. But I would check with your custodian. But you really want to just be able to clean things. And so anything that's cloth can't be easily disinfected, which is why we had asked, and the RSSL recommends removing soft materials like pillows and curtains and things out of classrooms. So just what you bring in, just think, can it be cleaned easily? All right. So playgrounds, fields, recess, breaks. We want kids outside. We want kids playing. So before recess, students just have to wash or sanitize their hands. And then after recess, if it's possible, because you get muddy, you get dirty, if they can wash their hands with soap and water. But if that's not available, it's perfectly fine to use hand sanitizer as well. Playground equipment will be cleaned once daily. It does not have to be cleaned in between cohorts. You do have to follow physical distancing and masking and all of that outside as well. Grade levels can be at recess together, and this is just considered an additional cohort, but since our cohorts are small, that is fine. So, the A-day first graders can be out together. But we do have to still maintain that 3 feet as much as possible as we can of physical distancing. Outdoor learning is also called out in the RSSL too, and I'm hoping that we can take advantage of this as spring happens, and most of our buildings have gardens and have beautiful outdoor spaces that we could take advantage of. And we know that being outside and connecting with nature actually improves mental health and helps kids have that relaxed alertness that they need to learn. So all that needs to happen here is you treat it like an indoor space, right? Maintain cohorting, social distancing, masking, traffic pattern support, all of that, disinfecting materials that are used. But if you're interested in outdoor learning, check with your principal, because we do need to establish kind of a calendar for how the outdoor space is used, so that it doesn't become used by simultaneous cohorts, so that there's time in between if things need to be cleaned, and time for that transition too. Restrooms. If you don't have a restroom in your classroom, cohorts will be assigned to specific bathrooms. After using the restroom, just like we typically would, students have to wash their hands with soap and water. They have to sanitize them before they come in the classroom again. And there will be site-specific protocols for bathrooms shared by your site leadership. But one thing that is recommended is to discontinue the use of permanent restroom and hall passes and those shared, sign-ins and sign-outs, just so that there's less surface touch. Staff breaks. It doesn't mean that we can't gather in shared spaces. We just have to observe all the safety protocols in those spaces. One area to just be aware of is that, anytime you remove face coverings to eat, then that increases risk. So if you're having a snack someplace, make sure that you're in an area you can safely do that, or go outside, right? Let's get out and get some sun as I look outside today. Other building activities and requirements. You do have to have emergency procedures and drills. So they should be carried out just as usual. If you're on a hybrid schedule like we are, you do have to do them for both cohorts. If you can't, for some reason in your building, have physical distancing during drills, then that's where that time and space comes in play. So we want to make sure that we are doing the drill in 15 minutes or less. And students just have to wash their hands or use sanitizer after the drill before coming back into their classroom. We shouldn't really be having school functions at this point. Most events should either be modified or postponed. But there are considerations in the RSSL for school-specific functions and facility features. And it's just all the same, right? Hand washing, sanitizing equipment, traffic patterns. One area too is personal property. So I know that folks have asked about water bottles, totally fine. You just have to establish site-based policies for how you identify personal property and how you store that personal property in a cubby, in a box, so that it has its own space, and labeling everything as well. All right, technology. Lots of questions about Chromebooks. Students do not have to transport their Chromebooks back and forth from home to school. With those ESSER funds that I mentioned earlier, we've been able to purchase additional devices. So they're, as kids are in the classroom, and I think Michael's mentioned this before, right? We don't want kids sitting in front of a screen if they're in our building. So, getting kids engaged in other ways as much as possible. But for some of those specials or those small groups that do still have to happen virtually, whenever possible, have a classroom device that's assigned to a student. And where that's not possible and we have to share, it's just a matter of rotating devices and quarantining them like we do with our library books or hard to clean materials for 24 hours between shared uses. Charging stations should all be in your schools already. A request from Christine, please, please, please do not wipe devices with cleaner, spray sanitizer, or alcohol wipes, as this actually starts to destroy our Chromebooks. And then finally, there'll be more on this coming in the near future, but just a heads up that Wi-Fi hotspots are changing. They still will be free, which is great. However, they will have less data available. So they have plenty of data for students to engage in online learning, do their schoolwork, but not enough data for streaming Netflix or video games. So our tech department is working on messaging that will be sent out shortly. Most of our our hotspots came last April, so we've got some time still to get that messaging out. All right. HVAC and windows. Again, maintenance has tested air quality in buildings, and they're ensuring that the systems in each building meet the guidelines. And what this will look like is some rooms will have air purifiers, some rooms will have to have windows open, and some won't. And actually, opening windows reduces air quality. So principals are going to provide you with site-specific guidance around your school and classroom needs to make sure that we're getting the best air quality possible that meets those guidelines. And then just a quick note on public health communication and training. So we have to communicate and train you all, which we're doing today and tomorrow. And we have to communicate any changes to any of these guidelines. We have to communicate with the family if there's changes, communicate with families about how schools are responding. And I know that on the helpful hint sheet that I will share with you all later today, there are some great resources for communicating with families in different languages too, that you can access as well. You'll see lots of new masks and things that are up. I did see a request for some different student kind of facing things to help with mask wearing and that sort of thing. So I'll make sure that I pull those out and put them on that help sheet too. Any questions that came forward, Christine?
Nope, we're rolling.
Awesome. All right. Transportation. I also want to give a big shout out to transportation and nutrition who have been working to tackle some really complicated scheduling and routines to make sure that we get kids to school and we get them fed. So make sure you give a big thank you to them as well. So with transportation, students will be visually screened before getting on the bus. If they are symptomatic, they will sit up front with windows open and they'll get off the bus first to arrive at school, which then will begin isolation measures that we talked about earlier. We had a question in the last group about, if students have symptoms, then why are they on the bus? It really is a safety issue, right? So some students are at the bus stop on their own. We can't just leave them there. And also sometimes, visually you don't see it at first and then you notice. And so it's really a safety issue so that we make sure that kids are being cared for from the moment that that the bus arrives. Buses are going to be cleaned frequently between riders, between each run. Staff are using hand sanitizer and masks, and students are as well. And your site leadership will convey routines for loading and unloading those buses. With our meal service, currently our plan, children are getting SAC meals. So they can pick up lunches from that 11:30 to 12. Your site time may vary a little bit from that. And there's also SAC lunches or meals available at 2:45 to be taken home so that kids have food for the following day. And again, this will be part of your meetings with site leadership to determine that pickup and pass out process. If at some point students do eat at school, we're not right now, but this is part of the RSSL, so I do need to let you know, just kind of the overview. Have to wash hands before eating and after. Staff serving meals, maintain distance, can't share food or have the buffet style that we've sometimes done. And then the physical distancing and the cleaning between cohorts needs to happen as in other areas of the building. Any questions about any of the cleaning, the custodial, any of that?
Can we give kids a snack if they're hungry during school?
That's a really good question. I think that's something that you're going to want to talk to leadership about, your site leadership about. There's not, and the RSSL has guidelines for eating. And I mean, I definitely think if it's part of a student's IEP or 504 accommodations, that's something you can work with a case manager around. Let me check and see. I can definitely follow up broadly with Michael in nutrition to see if there's a more definitive answer. But until then, I would look at the specific situation. So tomorrow, we're going to dig deeper into health and safety protocols. And so there's lots of different scenarios that if something happens, that determines how we respond. And so we will kind of look at some of those. There's some new exclusion guidance for when kids are sick that we'll go into. We'll also dig in a little deeper to some of the key practices for reducing spread that we talked about today. And then that includes also the visual screening piece with Julie and the nurses so that we know what we're looking for. And then also have some time to talk about tracking protocols and answer any questions that we didn't get answered today.